Flashing lights and floaters in the vision, very common symptoms that patients come in to see me with, and very common diagnosis. Whenever I have a patient come in who says they have some new floaters, or maybe they've seen a flash of light, I like to talk a little bit about eye anatomy so I can explain what's going on inside the eye. The first thing to realize is that the inside of the eye is mostly hollow. I mean, it's a big giant beach ball full of water. Well, it's actually not water. Inside the majority of the eye is something called the vitreous humor, or the vitreous jelly might be a better descriptive term. But the inside of the eye, when we're born, is filled with a material that's very much like jello, just like jello dessert. And as we get older, our jello starts to get kind of runny and watery, just like taking a bowl of jello out of the refrigerator, putting it out in the sun, you end up getting little pockets of water. The same process happens inside the eye. Now, as our jello gets kind of runny and watery, we'll sometimes form debris, and this debris floats in the back of the eye, casts shadows, and that's what we commonly describe as a floater. So if you have a floater, a little speck in your vision, or a line, or a squiggle, and you try to look at it, it runs away from you and wanders back into your vision, usually worse when you look at like a blank wall or up at a blue sky. These are completely harmless for the most part, and just debris floating inside our jello. You can kind of think of these as little pieces of pineapple or strawberry inside of our jello fruit salad that is the eye. So that's what a floater is. Now, this is a video at the microscope kind of showing what these floaters might look like. This is a slightly different process here, but it's a good example. Pieces of debris stuck inside the jello on the inside of the eye, casting shadows, which you can see as specks or spots or lines or squiggles, but very common. We all have a certain number of floaters. Now, invariably, probably once or twice a day, I see at least one or two patients really. A patient will come in and say, you know what, all of a sudden I saw a flash of light, or repeated flashes over and over, and there's a big new floater in my vision, and it looks kind of round, or maybe kind of like a spider web or like an ellipse, but it's new. I've never seen this thing before, and I'm having a flashing light out to the side. What's going on? This is very common. I see, like I said, one or two patients a day at least with these symptoms. Basically, here's what's happening. We end up getting pockets of water in the back of our eye. We already talked about our jello metaphor. At some point in our life, and this happens to everyone, we end up getting so many pockets of water in the eye that one day the remaining jello kind of peels off the walls of the eye, like so, and basically peels off the retina and forms a big blob of jello in the middle of the eye. If you want to compare this to our bowl of jello, you can imagine taking a bowl of jello, putting it in a room, and leaving it for several weeks and walking away. At some point, the jello dehydrates and kind of collapses, peels off the walls of the Tupperware container into a big blob in the middle of the bowl. Well, the same thing happens inside the eye. And as this jello peels off the retina, people will see a flash and sometimes see new floaters they've never seen before. This is a very common process. Happens to the vast majority of people by age 50. By the time you hit age 60, it's happened to even more people. For most people, they never notice it. This process happens very slowly, and maybe while they're sleeping. It's called a vitreous detachment, and that sounds scary, but it's not. It happens to everyone. But for some people, they see more flashing lights, or they notice it more. And of course, these are very concerning symptoms because they could be other things. And so basically, they come in and we check to make sure everything's okay. So this is an ultrasound of an eye. Just like you can ultrasound a baby and a expectant mother, you can also ultrasound the eyeball itself. This is the front of the eye as if the patient's looking over here. And there's the back of the eye. And you see all this debris floating in here? Well, this eye has nothing wrong with it. This is a completely normal eye. But they've got a lot of jello. It's kind of collapsed. You can see it moving in there. Look down. Look up. Look down. That jello has kind of collapsed into the middle of the eye and is just kind of wobbling around. And the patient has a couple of floaters, but no big problem. Now, almost always a vitreous detachment is completely harmless. That jello collapses off the walls of the eye, doesn't cause any problems. But every once in a while, as that jello is peeling off the walls of the eye, off the retina, it gets stuck and it starts to tug in one little spot. And if you tug hard enough on the retina, you can create a small hole or a small tear, and that could be a big deal. Because if you get a tear in your retina, that can progress into a retinal detachment, and that is a big deal because you can lose vision in a very permanent way if that's not picked up. So, any patient with new flashes, new floaters, we always say, come on in, we'll take a look, dilate your pupil, we'll look back there, make sure we don't see any tears or holes, and assuming there's not, you probably don't have much to worry about. I usually have my patients come back in about 6 weeks, So we can re-dilate, take another look back there, make sure it didn't miss anything the first time around, and assuming not and there's no new symptoms, then that's that. Things to watch out for in the meantime, certainly if there's even more floaters. The flashes start to increase in frequency, and probably the biggest one is a curtain of darkness. If a patient of mine sees a big curtain of blurriness or of darkness coming in from the side or above or below, well, that could be an impending retinal detachment. That's a big deal. I always say come right in if you have any weird symptoms like that. We'll take a look, make sure we're not missing something. So, vitreous detachment, or that jello collapsing in the eye, almost always is a harmless event, but it does cause new floaters, and I'm almost always invariably asked, are these new floaters I'm seeing ever going to go away? And the answer is usually yes, but it could be years. Basically, those floaters are floating right over the surface of the retina. They're casting a very crisp shadow. With time, hopefully that debris will float forward to the front part of the eye. The shadow will become less crisp, and you stop noticing them. Unfortunately, there's no real good way to fix floaters. You can't really remove them. I mean, I guess you could go into the eye and do what we call a vitrectomy and remove the jello. That's something a retina surgeon would do. But that surgery is a really big surgery. It's much bigger than cataract surgery and has a lot of complications. And in this case, the surgery is worse than the symptom. You just kind of have to get used to your floaters. But floaters, flashes, if you have new symptoms, probably ought to come in, get a dilated exam, make sure you're not missing something. But almost always a harmless event.
For more informative videos like this, visit us at mpeg1at5k. Or if you would like to make an appointment to see one of our doctors, please call 386-672-4244.